PCOS stands for polycystic ovary syndrome, which is a condition where the ovaries produce more androgens, which are male hormones, than normal. Androgens can interfere with the normal development and release of eggs from the ovaries, which can affect the menstrual cycle and fertility. PCOS can also cause cysts to form on the ovaries, which are fluid-filled sacs that contain immature eggs. These cysts can make the ovaries larger and irregular in shape. PCOS is a very common condition, affecting about 10% of women of reproductive age. It is also the leading cause of infertility in women, as it can prevent ovulation and make it harder to get pregnant. But PCOS is not just a reproductive problem. It can also affect your long-term health and increase your risk of developing other conditions, such as diabetes, heart disease, and cancer. The signs and symptoms of PCOS can vary from person to person, and they may change over time. Some women may have only a few symptoms, while others may have many. Some of the most common signs and symptoms of PCOS are irregular periods or no periods at all. This is one of the most common and obvious signs of PCOS. Women with PCOS may have fewer than 9 periods a year, more than 35 days between periods, or very heavy or unpredictable bleeding. This is because PCOS affects the ovulation process, which is the release of an egg from the ovary each month. Without ovulation, there is no regular menstrual cycle. Unwanted hair growth or hirsutism. This is another common sign of PCOS. Women with PCOS may have excess hair growth on their face, chest, back, or buttocks. This is because PCOS causes the ovaries to produce more androgens, which are male hormones. Androgens can stimulate hair follicles and cause more hair growth in areas where men usually have hair. Thinning hair or hair loss. On the other hand, some women with PCOS may experience thinning hair or hair loss on their scalp. This is also due to the high levels of androgens, which can affect the hair growth cycle and cause hair to fall out faster than normal. Acne. Another sign of PCOS is acne, especially on the face, chest, or back. Acne is caused by the excess oil production in the skin, which can clog the pores and cause inflammation and infection. Androgens can increase oil production and worsen acne. Weight gain or difficulty losing weight. Many women with PCOS struggle with their weight, as PCOS can make it harder to lose weight or maintain a healthy weight. This is because PCOS can cause insulin resistance, which is a condition where the cells do not respond well to the hormone insulin. Insulin helps the cells use glucose, which is the main source of energy for the body. When the cells are resistant to insulin, the glucose stays in the blood and causes high blood sugar levels. The body then tries to lower the blood sugar by producing more insulin, which can lead to weight gain and increased appetite. These are some of the most common signs and symptoms of PCOS, but they are not the only ones. PCOS can also cause other problems, such as mood changes, depression, and a negative body image. Some symptoms, such as infertility, obesity, and unwanted hair growth, can lead to social stigma. If you think you may have PCOS, the best thing to do is to see your doctor and get tested. There is no single test that can diagnose PCOS, but the doctor may use a combination of medical history, physical exam, blood tests, and ultrasound to check for the following criteria: irregular or absent periods, high levels of androgens in the blood or signs of excess androgens, such as hirsutism or acne, polycystic ovaries, which are enlarged ovaries with multiple small cysts that contain immature eggs. If you have at least 2 of these criteria, you may have PCOS. However, the diagnosis may vary depending on the doctor and the guidelines they follow. Some doctors may also rule out other conditions that can cause similar symptoms, such as thyroid disorders, adrenal disorders, or pituitary tumors. There is no cure for PCOS, but there are ways to manage the symptoms and improve your quality of life. The treatment of PCOS depends on your individual goals and needs, such as whether you want to get pregnant, lose weight, or reduce the risk of complications. The treatment may include lifestyle changes, medication, or surgery. I will talk more about the treatment options for PCOS in another video if you guys are interested, so stay tuned for that. I hope this video helped you understand more about PCOS and how it affects your health. If you have any questions or anything to add, please leave a comment down below. I would love to hear from you. And if you like this video, please give it a thumbs up and subscribe to my channel for more content like this. Thank you for watching, and I'll see you next time.